Hi, ladies and gentlemen, it's Laura and Andy again. I'm ever so sorry about that. We had a few technical issues, but we're going to try again. For those of you that maybe didn't hear the start of this webinar, I'm here with Andy Boote from Worcestershire Works Well. I'm going to hand straight back over to Andy because he was doing such a good job, but unfortunately none of you could hear him. So we're going to try again. And questions please at the end. Thank you, Andy.
Afternoon everyone. So my name's Andy. I work for Worcestershire County Council in the Public Health team. I'm here today just to have a chat about Worcestershire Works Well. So Worcestershire Works Well is a free to access health and wellbeing scheme that aims to improve the health and wellbeing of employees across Worcestershire. As I say, it's completely free to access, and it's delivered as a partnership between the private, public and the voluntary sectors. And I'll come on to talk about that in a moment, but it's really important because it means that we have a real sort of clear view of the whole of all the three sectors, and we're able to work with a number of different businesses on different things. Worcestershire Works Well is a three-level accreditation scheme, and one of the ways to think about it is it's almost like a business going through an MVQ. So the three levels obviously are progressively more difficult. So level one is relatively basic. So level one's all about beginning to spread health and wellbeing messages throughout the business. Whereas level two starts to look at how we embed a healthy culture through the business. And then level three really looks at what policies have we got in place, how do we evaluate what we do, and how are we really embedding health and wellbeing across the business. Is it part of our culture? As I said, it's completely free to access. And once you sign up, you're allocated a representative. So we have representatives from across each of our partners, and what we'll do is we'll allocate the representative that we feel best suits your business, and we'll do that in discussion with yourselves. So they'll come out and work with you through our three levels, but most importantly through the 9 standards. So again, thinking about it as an MVQ, we have 9 standards, and I'll come on to those in a moment. So we talk about the 5 partners. So as I say, I'm from Public Health at Worcestershire County Council, and we tend to look after the Promoting Good Health standard and the Smoking Cessation standard, but also the alcohol standard as well. So we look at how we're getting those health and wellbeing messages out to our employees. We also work closely with Worcestershire Regulatory Services, who focus on the healthy eating and health and safety standard, the Chamber of Commerce, who focus on our attendance management and leadership standards, One Us Works from the voluntary sector, who look at our mental health standard, and then the Sports Partnership, who obviously look at our physical activity standards. So we have expertise really from across the piece, from across each of our 9 standards. So before we go into too much detail about the programme itself, it's useful just to kind of set a bit of context. So look at why is workplace wellbeing important, and also try and change the perception that it's not just a nice to have, it's something that actually is really important to the health of the business as well as the health of our employees. So Worcestershire is an ageing population. And with that comes an ageing workforce. So we know that around 21% of our population is aged over 65, compared to around 17.3% nationally. So it's a significant difference, whereas as a county we're significantly older than the West Midlands and the UK. In many respects that's a massive positive. We know that our older employees are generally our most experienced, they're generally our most qualified staff. But we also know that our older employees are generally happier to work independently and generally more happy to work flexibly. So all of those are massive positives. However, a Talent Q survey of around 15,000 employees also found that older employees have different expectations of their workplace. For example, many older employees expect health and wellbeing initiatives to take place in the workplace. So they expect the opportunity to maintain or develop a healthy lifestyle at work. And that's very different to what generally can happen in workplaces where we can almost encourage negative behaviours. So we could have a canteen that has chips on offer every day, or we could have cakes in the office every single Thursday and Friday. So really, it could be about trying to take account of those things a little bit. We also know that as we get older, we become more likely to be living with a long-term condition or some sort of chronic illness. Now, generally we know that leading a healthy lifestyle can assist with the management of those longer-term conditions. So if we eat healthily, if we don't smoke, if we don't drink excessive alcohol, we're generally more likely to have a healthier lifestyle, but we're also less likely then to take days off sick. So we're less likely to have fewer days away from work. So we also say that a healthy workforce can increase productivity. So there's a piece of research which looked at 55 workplace wellbeing schemes from across the UK. Now in that piece of research, it had a look at which ones were doing well, what was good about them, and what were the impacts of having a positive workplace wellbeing scheme. They found that on average, productivity increased by around 54%. Now, how do you measure productivity? So what does it look at? It looks at things like the working week. So one of the businesses that were measured found that their working week actually reduced from 48 hours down to 40 hours. They found that generally businesses found there were a reduction in errors, so people were more alert when they were at work, they were making less mistakes. They also found that there was a bit of an increase in staff competitiveness. What we also find is that workplaces that have really effective health and wellbeing schemes can find they have improved staff loyalty and improved staff motivation. So we know that generally in Worcestershire, employment is really high. So around 77.5% of our 16 to 64-year-olds are in employment. So compared to the West Midlands is about 71% and the Great Britain is around 73%. What that tells us is that people have a choice. So our people in that sort of age bracket of 16 to 64, if they want to work, there are generally jobs in Worcestershire to go and get. What it means is that people in certain sectors are going to have some sort of competitiveness for good people. There can be good people who are going to have a choice of where they work. What we need to think about is what's going to be different between our business and somebody else's. And we found that actually having a good workplace wellbeing scheme can be something, if all the other things are really similar, having an employer that looks after their staff can be a really good selling point for some employers and employees. The most obvious thing around workplace wellbeing is looking at reduced absenteeism. So we know that the most common short-term absences are attributable to colds and flu, to stomach upsets and stress. All of these things we can reduce the likelihood of if we lead a healthy lifestyle. So all of the things that we've already talked about, so people who don't smoke, who do lots of physical activity, who lead a healthy lifestyle in terms of what they eat and look after their weight a little bit. So in terms of Worcestershire Works Well, it's just worth spending a few minutes just looking at where we've been and where we're looking to go over the next few years. But Worcestershire Works Well was developed about 5 or 6 years ago through a pilot that was delivered at DHL in Droitwich. Now the pilot was delivered as a result of a premature death in service. So a member of their team died due to something that could have been avoided, is probably the best way to put it. But generally due to health and wellbeing issues, so things that they weren't managing their health and wellbeing as well as they could have been. So the directors of the business wanted to improve the health and wellbeing of their staff, really to prevent a recurrence, partly as a duty of care. So they approached the NHS at the time, the NHS Worcestershire, and sort of had a look at it and saying, what can we do about it? What can we go and do differently? So rather than just march in and sort of unload lots and lots of health and wellbeing initiatives, what they looked to do was try and find out what were the problems. What did people think about working at DHL? What was good about it? What was bad about it? What could we do better? But also looking at how healthy were people who worked there. So the first thing they did was look at health MOTs. So they looked at measuring people's blood pressure, measuring people's weight. They found that from the 55 staff that were measured, around a third had high blood pressure, which is a major risk factor for many long-term conditions. They also found that around 3/4 were either overweight or obese. Again, another major risk factor. They also looked at carrying out a staff survey to find out all of the things that I've mentioned before. So as a result of that information, they were able to sort of start to embed some health and wellbeing initiatives, some intervention, if you like. So that information proved a real sort of catalyst for change. So the things that they looked to embed was they put a stop smoking service on site so that it was really easy for people to access. They looked at providing health walks for staff and their families. So they could provide those during the day, they could provide those before work, but also after work. So things like staff fun days, they could have staff walks going on at those sort of times. They also looked at the biggie really, which is healthy eating options in the canteen. And this isn't about making sure that people only eat healthily all of the time. Actually, it's about people having a choice and spreading messages so that people are aware of what's better for them. So it's not saying you can't have chips ever. It's actually saying maybe we should have chips available just once a week and have healthy options available the rest of the week, and sort of small changes like that. They also work with local fitness organisations to make various physical activity schemes available for staff, so corporate gym memberships and that kind of stuff. Now, I'm quite aware when we talk about these things, people will often say, well, that sounds really nice, but actually what's the point? What's the real impact of doing that sort of stuff? Well, actually, within a year of doing that, DHL found that their sickness absence has reduced so much that it was saving the business around £40,000 a year. So their sickness absence had dropped by such an extent it was saving around £40,000. What they didn't take into account was there any improvements in staff turnover, so the savings they were making in recruitment, savings they were making in staff training. So other real big savings that the business was making, but they measured just their staff sickness and it was still around £40,000, which is a real significant sum. A couple of years ago, in October 2014, the Worcestershire Works Well initiative received national recognition. So the RSPH, which stands for the Royal Society of Public Health, actually recognised us as one of only 14 organisations and awarded us with a 2-year Health and Wellbeing Award. So they generally offer sort of 2-year and 3-year awards, and or 1 year. They offered us a 2-year award to sort of recognise what we were doing around health and wellbeing and to improve the health of employees across Worcestershire. Our aims from that time really were to grow the project. So in the last 2 years we have seen some significant growth as an organisation, or as an initiative if you like. And in the last 12 months, that's what we can see on the screen now. So we set ourselves quite an ambitious target at the sort of 12 months ago, and we looked to improve our reach by 25 businesses. So to get 25 new businesses in the last 12 months. And we achieved that. We actually achieved about 26, 27 new businesses in those 12 months. And at this point in time, we have 82 businesses in Worcestershire currently working to some form of accreditation to Worcestershire Works Well. The really impressive bit is that actually that's now accounting for 25 employees across Worcestershire, which is about 10% of the workforce. So this relatively small initiative now actually impacts on around 25,000 people, and theoretically their families and their communities, but 25,000 employees for definite, which is about 10% of the people that go to work in Worcestershire, which we feel is a real sort of significant chunk, if you like. What we're looking to do this year is we're looking to continue to grow that. We'd like to be sat here in 12 months' time saying we've got 100 businesses that are working toward Worcestershire Works Well. And that's really what I want you to think about today, is to think about, do you want to find out more about the programme? And we'll talk about the website in a moment. But we'd really like to find out a bit more and come and sort of speak to us about how we can maybe work with your business. So moving on to the next section is really to look at some of the businesses that have taken part in the scheme and how they're getting on. So Southcode, one of our most successful businesses. Southcode are a relatively large business, and they've got 250 employees, and they're a business that is a mixture of routine and manual workers, but also office-based staff as well. They create access hardware solutions, so things like latches, hinges, screws, electronic locks and that kind of stuff. They achieved the Level 1 accreditation in May 2013, but they also became the first Worcestershire Works Well business to achieve their Level 3 accreditation in September 2014. And a really nice way to show the difference between those two. In Level 1, it's all about spreading healthy messages. So you're giving people leaflets on smoking cessation, you're letting them know where they can go for support. Whereas in your Level 3, it might be about getting rid of smoking shelters, so making sure it's a no smoking site completely. And you can see there's a real difference there between Level 1 and Level 3. Southcode's feedback on the programme, they've told us that it's a well-designed and user-friendly toolkit. So the toolkit's what we work through to help you get your accreditation. And they found that they were doing some things around health and wellbeing, but it didn't really have any structure. It was almost like intermittent shouting. So we'll shout about smoking for a month here, and then we'll shout about alcohol for a bit in January. But there was no clear structure to what they were working to. They found that by having the toolkit to follow and working with their representative, they were able to kind of get real structure to their programme and able to have a real purpose and a vision about what they were working towards. Another example of a business that are doing well, working through the programme, is Titanio. And the reason I picked Titanio as sort of an opposite to Southcode is they're a much smaller organisation. So we're looking at Titanio as having around 15 to 20 employees compared to Southcode, which had around 250. So Titanio are a much more kind of office-based organisation, so they develop security auditing software products, so very sort of IT-based. But again, they signed up to the scheme back in March 2013, achieved their Level 1 in April 2014 and their Level 2 in September. So they worked through the programme relatively quickly as well. They're telling us that the benefits for them of working with Worcestershire Works Well are having lower than average absence rates. So they look at their sector average and they know that their absence rates are significantly lower than what they'd expect in their sector. Actually in 2014 they were able to go 2 months with no absences at all. One of the real biggies for them though has been a reduction in staff turnover. So working in a sector where there aren't that many good staff to get in, they found that their staff turnover has reduced down to around 10%, which is actually saving them around 11 grand a year, so £11,300 per year. It's also saving them around £5,000 in recruitment, and then untold amounts in staff training they're not having to spend. They've also reported real solid recruitment benefits. So again, when they're talking to a limited pool of people who can come and do the jobs they need them to, having this kind of workplace wellbeing stamp has really helped them when negotiating sort of for new starters. So some of the perks of being involved in Worcestershire Works Well. So we've talked about the fact that you're assigned a representative who has a real knowledge about your sector or has a knowledge about your area, and we'll be able to work you through the toolkit and help you towards accreditation. And they're kind of there as much or as little as you want them to be. What we also have is a Worcestershire Works Well website, and the address is at the bottom of your slide, so it's worcestershire.workswell.co.uk. And on there you're able to access our campaign packs. So pretty much 6 times a year we run a public health and wellbeing campaign. You can see when this one was taken it was mental health and wellbeing, but anytime you log onto that website you can see what campaign's going on at the moment, and you can download all of the materials to help you kind of embed that campaign into your organisation. Through the website you're able to access the toolkit, so you can have a good look at what does it mean, how do I get to level 1, and what does that consist of. You're also able to then sign up to the scheme. If you do decide to sign up to the scheme, what will happen is we'll get an email and we'll let you know we've received your interest, and then we'll then start to assign you a representative. So that normally takes a couple of weeks. So you'll be assigned a representative who will then start to work with you as quickly or as slowly as you want to, but to try and get you towards accreditation. One of the other perks around Worcestershire Works Well is we also run 2 events per year. So we run 2 what we call biannual events. And they're events where we look to bring together all of our organisations, or as many as we can. So we generally get around 70 people come to our events, so generally around 50 organisations. And people come together and we do it to find out more about a particular health and wellbeing issue. So our last events have focused on mental health. We've also focused on men's health. In the past we've focused on drugs and alcohol. But we'll talk about stuff that people want to know more about. So we'll focus on what it means for a business if you've got mental health issues in the workplace, so if you've got drug and alcohol issues, where do you stand legally, how prominent are these issues, how regular and how normal are they. But we'll talk about them, we'll give people lots and lots of information and give them lots of stuff to take away, and also lots of signposting information where they can go for more stuff, if you like. But those events are only for businesses that are signed up to the programme. We're also working on additional benefits, so things like training schemes we're looking to get people on, so businesses that are accredited to Worcestershire Works Well may be able to access RSPH Level 2 Understanding Health Improvement Training, and that will be coming in the near future. So just to recap, Worcestershire Works Well is an employee wellbeing programme that works across 3 levels, and it's an accreditation scheme across 9 standards. So thank you very much for listening. Hopefully you managed to hear us the second time round. You can find out loads of information on our website. If you wanted to ask any other questions, by all means drop us an email on the email on the screen, and we'll do our best to get back to you.
That's great. Thank you, Andy. Once again, ladies and gentlemen, sorry for the technical issues that we had there. If you have any questions, if you could post those to us. We have had a couple come through already. The first one, Andy, is from Mike, and the question is, how long does it take to become accredited to this scheme?
Generally it differs from business to business, so the 2 businesses that we spoke about earlier managed to work their way through it quite quickly, but your rep will explain that generally it takes as long as it takes is the best way to say it. So some businesses do things really quickly, other businesses can take 12 or 18 months, but generally it's all about your business and how we do things to suit you.
Great. And there's another question coming through here, it's from Mel. Probably the question that everybody wants the answer to, does this cost money? And if so, I should imagine you're asked this a lot. If so, how much?
It's absolutely free to access, so it's funded by Public Health, and it is free to access for any business in Worcestershire.
Okay, that's great. Thank you, Andy. I'd like to thank Andy again for hosting today's webinar. We will be sending out a copy of the presentation and Andy's contact details over the next couple of days. Before we close off today, just a very quick reminder, this webinar is part of our service to our Smart Room members. If you're not already a member or a BizSmart client and would like to access the archive of webinars, we invite you to visit our website, which is biz-smart.co.uk, and then go to the Smart Room page. We hope you enjoy the rest of your day. We'll see you again this time next week. Thank you all for listening. Thank you.